Do you trust the government?
Do I trust the government? Do I trust the government to tell me the truth, to do things that no, the government, by and large, that I think that those millionaires and billionaires, the guy in the shirt likes to talk about, exert vastly too much influence. But here's where I think people often go wrong from that true premise that the government is untrustworthy. I think premise is fine, but the conclusion, therefore, we should have less government in the sense of we should have less expansive social services. We shouldn't give everybody health care. I think that that's a fundamental confusion, because I think that there's a difference between talking about what the government can do to you. And there we're talking about police, ICE, the expansion of the national security state, and what the government has a legal obligation to do for you in terms of supporting what I would see as fundamental human rights like healthcare and education.
Let me tell you where I think there's a flaw in this, and I really want you to talk about this. You say healthcare and education. There must be bureaucrats to enforce these things. You need the administrative state. So then you get the CDC, you get the NIH, you get unregulated agencies that you, as being someone who focuses on democracy, focuses on the power of the people, where is the check and balance against the CDC, the NIH, HHS? For every government program, you need hundreds of thousands of desk workers, which is where the word bureaucrat comes from in French. So you say you don't trust the government, yet you support expanding the social services, which will then necessarily expand government. Why do you want to expand something you don't trust?
Well, first of all, congratulations on the French vocabulary. I like it. But
I have other words too. We could après nous les déluge, which means after me the flood. We could talk about all my favorite French terms if you'd like. We could do a whole thing. You write for the Jacobin magazine, for goodness sake, so we could exchange notes on Robespierre and Jean-Jacques Rousseau. I've only read the Confessions once. Go ahead.
Okay. Well, I'd be happy to do all of that. Although, my French is like Duolingo. I can't do that much. But
I'm done. I promise.
But I would say that if you don't want bureaucrats to have more power, if that's the big objection.
No, that's part of the objection.
Okay,
it's an element of it.
Sure. So let's start with that element. So if you don't want bureaucrats to have more power, then the thing that you should really object to, right? Because you said earlier, you think we got to have some kind of social safety net. So we're agreeing that there are some social services programs. We're arguing about how expansive they should be and how they should work. So
generous versus limited.
Sure. Okay. But this is the thing. If you want those bureaucrats to have less power, you don't want limited. That's the last thing that you want. You want generous. And here's why. You're gonna have to convince me on this one. I know. Like I really liked what you just did there. That was some good.
So to restrain their power, you must give them a lot of power.
No, you're not giving them any power. You're taking away their power. It's a really simple argument. Here's how it goes. That means-tested programs give power to bureaucrats. When you say you have to jump through all these hoops to qualify for something, and there's some bureaucrat who gets to decide whether you get it or not,
here's why
bureaucrats have more power. Whereas when you say this is a legal right that every single person has as a citizen, no Canadian is having a bureaucrat decide whether they qualify for healthcare. Or in Finland, you talked about all of the policies that, in Norway that you thought would be an issue for me. Finland
is the poorest
where they have
country.
Okay, I don't think it's because of this, but in Finland where they don't even have private schools, and certainly you have a right to higher education as a citizen, the way that you have historically in lots of countries, and I think it's worked very well. But when you have that, you don't have students jumping through financial aid, bureaucracy, hurdles, and does this person qualify to get school? Does that person qualify to school? Where bureaucrats have the power to decide what's up, because that's the case where bureaucrats have power over you. If everybody gets something as a right of citizenship, bureaucrats have no power in that circumstance.
But let me ask you something though. So you want Medicare for all.
Yeah.
Yet HHS is the largest civilian branch of our government. So as we have expanded Medicare, as we have expanded Medicaid, it hasn't been means tested as you want. We have hundreds of thousands of desk workers that are doing the means testing. Are you qualified? Yeah. Medicare reimbursements. And so even under your example, Medicaid, it's woefully idealistic. The point is
Medicaid is a means
testing. You cannot have a generous social program without a massive bureaucratic and dare I say, corrupt administrative state.
Well, I think
Woodrow Wilson would even say that.
Well,
he says,
I
you
mean,
need the
you,
administrative
you
state.
think I like Woodrow Wilson, the guy who
Probably.
the
He
guy
was a college professor,
okay,
so
well, okay,
and a college president.
uh,
So he's kind of in your world.
well, okay, trust me, neither of those things earn any points for me, but
Okay.
but I think that
That's fair.
but I mean, Woodrow Wilson is the guy who resegregated the federal bureaucracy
Oh,
after it
trust
was
me, I could
integrated.
do a whole speech on
He
that.
put Eugene V. Debs in jail. Nobody on the left is going to see Woodrow Wilson as a hero. Liberals, nobody on the left. But I was just going to say,
I know plenty of people that would, but that's fine.
I don't
How
think
about-
I don't think you're going to find a lot of socialists
FDR,
who agree.
LBJ,
But
John
they have
Dewey, all these people believed in a strong administrative
Well, I
state.
mean, you're rattling off a bunch of liberals, but that's okay. We don't need to argue about the historical figures. Let's just say this. If you're talking about administrative state, bureaucracy, well, your example is Medicaid, which is a means-tested program. And even at that, even despite the means testing, which is the part that gives the bureaucrats their power, which is also the part I'm objecting to, even despite that, we're talking about bureaucracies. As I think you mentioned earlier, the government has no monopoly on bureaucracies, plenty of bureaucracies in the private sector. And if you want to know which programs have the smallest overhead, right? Even Medicaid, even despite the means testing, Medicaid, Medicare, all of those have much smaller administrative overhead than any of the private insurance companies, because the private insurance companies, one, they have to plan out their strategy for competing with each other, and two, the private insurance companies have a vast bureaucracy that is dedicated to finding ways to deny people's claims, because they've always got one eye on the bottom line for shareholders. And one question I'm very curious about, by the way, is that you object for all of these reasons. You think it's too interventionist. You think it's too much administrative state to just providing everybody with health care.
These are all elements of the critique.
Providing people with health care as a human right, so that you can have, like, what people I know in the UK always tell me, which is, hey, when whatever, my mom got cancer, when whatever the situation is, people will say, the only person I ever talked about this was with a doctor, which is very different from Americans' experience with healthcare. If you can object to that on the grounds that that's too much big government, I am really curious whether you'd say the same thing for fire services. Like, would you be okay with it if we didn't have public fire services?
Absolutely not. As I said, small but strong.
Okay.
The government exists, as it says in the preamble of the Constitution, amongst many other things, to secure the blessings of liberty, to ensure domestic tranquility. And Hamilton said it best, that you need a nimble yet effective federal government, good at what it does, but not overreaching. And that's the whole idea of conservative populism, is within this constitutional republic framework. I'm a big fan of firefighters, police officers. I'm a big fan of Border Patrol. I'm a big fan of all these sort of things. But when all of a sudden, I believe, you get outside of the constitutional limits, is where you birth this fourth branch of government. And our mutual hatred of Woodrow Wilson is a perfect example of this, because he really believed the state, this is a Hegelian idea, will usher in that utopia, that the state is God, that through the mechanisms of the state, we will be able to turn the chapter and with it remake man. He wasn't the only person that believed that. FDR did, Lyndon Baines Johnson did as well, where we as conservatives and conservative populists say, hold on a second, that is not what the state is there to do for. Let me just say one last thing, which is that the state is there to preserve the natural law with prudence and wisdom, to hopefully develop families and foster children, not to try to remake human beings. When it comes to healthcare, not only do I have a moral complaint that it's not the role of government, it's also not good at doing it, and it also hurts the everyday common man. So I have two.
I don't think either of those things are true.
But I have a moral argument, and I also have utilitarian argument. I just want to make sure that's clear.
Let's start with the moral argument, because I am very unclear on this. Because why is it that having public firefighters or public police is not overreach, but having public health care is? Why would it be objectionable if, instead of having public fire services that everybody gets to use, you had everybody just having to have private fire insurance? And if you had a better private fire insurance plan, they'd probably put out your fire, faster. Or maybe we had public fire insurance, but only for the poorest people or the oldest people, which would be the exact equivalent for healthcare. Or the same thing for policing, the equivalent, for like security insurance. Because all of these things seem very similar to me, because having your house burned down, being victimized by a crime, or needing chemotherapy, those are all cases where your life and limb is in danger. Like these seem pretty parallel to me. What do you see as the big
Well,
disanalogy?
So the first problem, it's mostly local, police and fire, so therefore it's more accountable.
Okay.
So the dollars don't go to some sort of albatross to the kingdom of Washington, D.C. of unelected, unknown, kind of just unchecked bureaucrats. That's number one. Number two, we do have a system in the country, despite what you're saying, where if you need health care, you will be taken care of. Is it
Well, that's
broken? Is it
what I
inadequate?
just said, though, right?
Well, hold on a second. It's already, I'm saying it is illegal to deny someone service of care. Illegal. Now, do we have problems with our healthcare system? Do you think if you could put me in a room and I could strike a huge bargain with you, I think that there are elements of the German system that are admirable. I will say that, where you have a public system and a private system. Where I start to all of a sudden say timeout, no go, no fly zone, is where I hear people like Bernie Sanders, and I'm paraphrasing, who want to get rid of private insurance as we know it. That's a big mistake. Healthcare, here's how I think the biggest problem with healthcare is. It's not individualized. It's way too bureaucratic, way too top down. And yes, we have pharmaceutical companies that are addicting people to drugs that they should not be addicted to. We have a sick care problem in our country. And I agree with a lot of people on the left with this, maybe we'll agree that we have an obesity problem. We have a problem of how we get our food. We have a corporate farming problem. I agree with all those things. Do I think that a government-run system of healthcare that will be more similar to how the IRS or how the Postal Service works, that's how somehow going to be the solution to that? Absolutely not.
Well,
but
I
if
mean,
you put me in a room,
the Postal Service is say
that again?
The Postal Service is amazing. It has been an engine of upward mobility. It has been an engine of racial equality. If you building the black middle class, massively an engine of that.
Have you ever used the Postal Service?
I have, and the Postal Service will carry a letter from here to Alaska.
So will FedEx.
No, not for the same price, and they're certainly not going to serve.
You know it's going to get there.
No, I do not know that, and it's certainly not going to do it. It's never going to get there with as much service to out of the way rural areas.
I got to give you credit.
Anything.
I've never heard anyone defend the post office.
Like as cheap. Well, you need to talk to more people because like the post office is an amazing institution, and it should be massively expanded. In fact, one of the best things I think they have in some of those Scandinavian countries is postal banking, which if we did that, Bernie Sanders' proposal would immediately put out of business all the payday loan vampires that prey on unbanked people, would create millions of new good unionized jobs. Postal Service is great, but I do want to go back because I don't want this. I don't want this to get lost.
The post office lost hundreds of thousands of packages and was 6 months late. That's who you want to run our healthcare system?
I think that. Well, first of all, I think that if you actually have a fairer look at the numbers, I think the Postal Service does do a really good job. I think that oftentimes when people say no, they are not using the same metrics to evaluate it they'd use to evaluate everything else. But if you want to know something that would be very much like what Medicare for All would be like if we had it in the United States, then I'd say looking at delivery of packages is probably not what you want to do. What you probably want to look at is countries like Canada, where they already have Medicare for All, Great Britain, where they've gone further, and the hospitals are publicly owned.
That's all the. Let's talk about that.
Well, okay, but those are places.
That's a different
thing.
Thing.
Where people live longer, where fewer of their babies die, where the rate of mortality amenable to healthcare is way better. Or look, you said you want it to be local. That you don't like the fact
super localized.
Sure, local, great. So if all the hospitals were municipally owned, you'd be cool with that?
All the hospitals, it would be, well, first of all, that's actually the case in a lot of places. There's a lot of county-run hospitals all across the country.
I'm not denying they're county-run. Okay, so you wouldn't be okay with that. So it really has nothing to do with centralization.
Well, no, it does. Trust me. The city of Chicago can be equally, if not more corrupt than the Kingdom of Washington, D.C.
Is it going to be more corrupt than the private insurance companies?
I mean, that's a good question.
Okay,
let me ask you a question.
But you did also say, right, and I really want to make sure
local is generally better, but I'm not going to die on the Cook County is a great county hill.
Well, this does go back to what you said earlier, though, when I asked you about fire protection, because you said, well, the difference is that nobody could be turned down from the hospital.
That is a law.
Yes, that is a law. I'm glad that it's a law.
I am too.
Okay, good, wonderful. We agree on that. That is a good government intervention to stop the private sector from doing what it would otherwise do and did otherwise do before that law was passed. But also, I would say, do the equivalent for the fire services. That the only people who get it without having to pay at the point of service are the poorest people, are the oldest people. Everybody else has to rely on private fire insurance, which varies wildly in quality. And if you don't have private fire insurance and you're not poor enough to qualify for the means-tested, bureaucrat-enabling system for poor people, and you're not old enough for the other one, and you end up having to have the fire department come and save you anyway, then you have a giant bill that's going to bankrupt you. Do you think that sounds like a fair system?
No. So let me ask you a question.
Yeah.
So is that, here's where, how do you define healthcare? This is a very important question, right? Because healthcare could be, hey, I just got a gunshot wound I need to be taken care of. Absolutely. Or healthcare could be, I'm 800 pounds overweight, I'm eating terribly, I have no sort of interest to exercise or eat well. Why all of a sudden should that person be put into the same exact level of care of someone that has saved money and taken care of their health? Why should someone who's 800 pounds overweight be given in this sort of, realm? Why should human agency and choice have zero emphasis at all?
What you're describing, the only difference between that and what already exists in the United States is that we would have to add, and they're rich enough that they can afford really high quality medical care. Right now, somebody who's 800 pounds, who doesn't watch their diet, who chain smokes, etc.
I agree. Yes,
but
you could add chain smoking.
But sure, all those things.
So you think that none of that should be given a preference?
Well, here's what I'm saying: that I think in the system that we have right now, somebody who checks every single one of those boxes, but is rich enough to afford the best medical care, skips in line ahead of the person who takes care of their health, exercises every day, doesn't smoke, eats well, but lost their job or just is cobbling together 4 part-time jobs like so many Americans are, and thus doesn't have employer health insurance.
It's an interesting question. So you believe just because you have better money, you shouldn't be able to have better stuff?
I believe,
or more money, better stuff.
I believe that when it comes to something like healthcare, no,
that's a very broad thing.
I do not believe that people should get life-saving services preferentially because of how much money they have. I think that,
so how much money they've saved. How about that? Someone saved their whole life and they said, in case there's a disaster, I'm going to put $500 away a month. They get to age 45 and all of a sudden they realize that they have some sort of health complication. They shouldn't be able to take advantage of the money they've saved for their entire life.
Well, this actually goes back to the very first thing that I said, like the opening couple sentences.
What is justice,
that I said, because what I said is that I don't want some people to have dramatically worse lives than others because of factors outside of their control. Now,
what about things they can control, though?
Well, if we
saving
money, if we lived in a world where all economic inequality was due to thrift versus indolence or laziness versus industriousness, I would have much less objection to this stuff than I do in the world where we actually live, where somebody who saved up their whole lives, but then they have unexpected medical expenses that bankrupt them, which happens all the time. That they have is going to get worse health care than somebody who has never saved at all, but is somebody if Hunter Biden, right, had some massive medical bill tomorrow,
he would probably have. Considering his lifestyle.
Sure, right? So if Hunter Biden had that huge medical bill tomorrow, then he would get in line ahead of people
for multiple reasons, both access to power and also money.
Sure.
So that's a good example.
Those are both bad things, but they have
largely unearned, and I agree.
Sure. So, and I would say the same thing about the Walton children. I would say the same thing about anybody who is inheriting money. When you go to the hospital, or you go to buy insurance, they don't ask you, did this money come from being thrifty and saving your whole life?
Let me ask you a question.
Or did this money come from stock ownership? Or did this money come from inheritance? They just ask, do you have the money to afford this?
And that's part of markets, right? Is that you're not able to make a moral claim for every dollar bill, but generally markets will go towards value and value creation. We're up against the hour break, and we're going to take a short break, and then we're going to resume, if that's okay with you.
Absolutely.
So I got a lot more I want to go to, but I actually want to close this thought on one thing, because it goes to your other thing that
actually, could I mean, if you'll indulge me, could I ask you like a 30-second question?
Sure, because I really want to close that point.
I know we're coming up to it,
yes.
but I'm so fascinated by this, right? So we agreed
Is it the
earlier.
firefighter thing again?
It's not the firefighter.
Okay, good.
Okay. Although, I think there's more to discuss
I'm
there.
very anti-fire.
They have well, that's good. You should be equally anti-cancer, and
I
then
am
just like
anti-cancer.
we have fire departments, we should have Medicare
That's why
for
I
all.
think people who
But
eat
they
well
have
and don't smoke and make good decisions should be rewarded for human agency.
Yeah, which is not at all what
Because the
markets in
inverse of
healthcare
your
do.
statement, I
But
just
they
want to
have
make
a-
sure this
but-
is clear.
but-
The inverse is you say that people should not be penalized for factors outside of their control. The inverse is that I think people should be rewarded for factors inside of their control.
Yeah, and
which
most
is
of
a
what
preference
what
on
we've got right
human
now
action.
is not
No,
about.
I agree with that.
But they have
so
a- but-
I want a
but- but-
system
but-
that rewards
but
people for
here's-
good choices.
Okay, so here's what I want to ask, real quick,
Sure.
I promise. So we established earlier how much we both liked Jeff Bezos.
Yes.
Dislike best Jeff
Are you going to
Bezos.
ask me, should I raise his taxes?
Well, because this is why I'm curious about
As
it.
I probably will be.
Because I saw in 2019.
Yes,
at
with
Polit-
Kyle Kalinske.
Yeah, and he asked you, would you be willing to raise Jeff Bezos' taxes by like 1% to provide housing for every single homeless veteran? And your response at that time was that you'd hope he'd do it voluntarily. And I think at this point we've established that's not going to happen. He'd prefer to buy a spaceship. So
That's probably true.
uh,
Yeah. So if you put a gun to my head, would I raise his taxes? I mean, I guess if I was a representative, I guess yes. For
okay,
oth-
that's good.
For
This
other
is,
reasons.
this
But-
is progress. I'm
but
so proud of you,
Let me tell
Charlie.
you. I said, I guess conditionally, if all of a sudden there would be a comparable piece of legislation alongside of it that would actually value and prioritize things I cared about. If it was just to raise his taxes to go into the current albatross
Okay,
pit of the
if it-
administrative state, I'd rather have him buy spaceships than give money to Fauci.
But if it was earmarked for a housing for homeless veterans, and you would say yes,
the
now,
answer is yes, because I think Jeff
outstanding.
Bezos,
This is
from a
this
moral
is such
standpoint,
good progress.
But let me tell you why. Let me clarify why.
Sure.
Jeff Bezos games your favorite department, the Postal Service. He games the corporate tax loophole
Yeah.
system. Jeff Bezos has a total disregard for what I consider to be the American way of life. And he has this weird fascination of going into orbit. And guess what? I hope he stays there.
Okay, well, I congratulate you on this progress.
Well, I mean, you could call it progress. You could also call it a commitment to prudence.
Okay,
which
no,
is
no, but
it's that Greek
it's a
word
new- it's a
prudentia,
newfound-
which is
it's a
looking at
newfound
things as
commitment
they
to
are.
prudence. You have been watching free public content from Give Them an Argument. To access every single episode of the show, the main show on Monday nights, all of the streams, all of the debate breakdowns, all of the patron-exclusive post-games on Monday nights, all of the patron-exclusive bonus episodes every week, and much, much more, go to patreon.com/Ben Burgis. I cannot resist ending this with, don't be foolish.